All right, in this video, you're going to get to watch a standing surgery for our horse here called Amazon, who's got a bad eye problem. And after much effort, we're going to end up having to remove this eye. Get a good 5 minutes and I'll block Autumn.
Okay.
So this horse came to us today for a chronic eye problem. When they've taken to the university, ophthalmologists have looked at it. Nobody can get it healed, so it's time to remove the eyeball. So we've got the horse obviously sedated. Autumn's been prepping the surgery site. Now we're going to do some nerve blocks to block the eyeball and all the surrounding tissue. She'll feel a lot better with that eyeball gone. It's super painful. That looks good, Autumn. So here we're just gonna get the nerves as they originate up towards her ear. So even though we're working on the eyeball, we got to hit these nerves as they come out, and we'll desensitize all of the skin around the eye. We'll actually be cutting through the eyelids. This is a technique that works really good standing. Fortunately, with the drugs that we have at our disposal for sedation and pain meds and blocks, we can do this in a standing horse and don't have to run the risk of anesthesia. So looking at this eye, I mean, that makes my eye hurt because it's just super painful. You can see all the blood vessels forming, the cornea is steamy, the terrible uveitis or pupils myotic. Our pupil and horses' pupil is a very specialized muscle, and when they have problems, it spasms and closes shut, and that's painful too. So here you can see the local anesthesia, long-lasting form of lidocaine under the skin to block all those nerves. And she's sedated. She's got pain meds on board, so she knows we're there, but she can't feel anything at this point with those first few blocks in. And the most challenging nerve to block in these surgeries is the optic nerve. That's the one that comes in from behind the eyeball, and it's almost as big as my pinky in this shot. So getting that numb is very important. It can be very difficult too. There's a couple different techniques we can use. In this one, I'm going to use a bit of a modified technique where we take a spinal needle and go behind the eye and block it. The other way you can do it is up in that depression behind that syringe. You can go straight down and hit it. But the way we're going to do it today in this video seems to work better, because you definitely want that thing numb when you go to cut it. So she's probably been in chronic pain for a long time with this eye, and unfortunately with eyes and horses, there's just, you run out of treatment options and they don't respond, and the best thing you can do for that animal is get that painful eye out of there. She still looks pretty good, but a lot of these that come in, they can't keep weight on them. That chronic pain just melts it off of them. So this is a little topical stuff that we'll put on the eyeball itself to numb the cornea and everything. She's a really good patient. She's handled everything well, and they have tried everything. They've been to the board certified ophthalmologist and gave her the best chance, but unfortunately sometimes it doesn't work. So then we get to bend the needle. So I'm just bending this needle because I'm going to follow the curvature of that globe and snake it around the eyeball to go back behind it and fill up that space and hit that nerve with the local. That way, by the time we get back there to cut that nerve, she won't feel a thing. There's our block at the noon position. So she can feel a little pressure there, and she knows we're there. But after we get this one in, she shouldn't feel hardly anything. There's a stylet inside that needle. That way it doesn't fill up with with tissue and plug up your needle. That was that first one I pulled out of there. So we'll fill up that structure, and it'll push the eye out just a little bit. And then we'll inject as we pull it out to numb all of that too. So we'll hit it from 4 different angles around the eyeball. Like I said, that nerve is very large back there and hard to anesthetize sometimes. So she's so cooperative, it makes these blocks way easier for us to perform. You can see her eye kind of push out there as we fill in that space behind it with the anesthesia. We'll hit it at noon, 3 o'clock, 6 o'clock, and 9 o'clock. You can actually see the fat pad above the eye get a little bit filled up there too. That lets us know we're in the right area.
Watch that fat pad up there, you'll see it kind of.
Where I point to there, there's that fat pad I was talking about. You can see it kind of fill up with that stuff too.
See how the eyes bulged out now? That's one right way you know you're in the right spot.
And the local we put in there will diffuse out too as we're doing the stuff, everything to get back to that optic nerve. So that'll give our block a little bit of time to work. And this is a standing procedure. We're not in a completely sterile operating room, but we're as aseptic as possible. And she'll be on antibiotics afterwards, and we'll mitigate every risk of infection we can. So the first step in the surgery for this technique is to sew the eyelid shut, basically. We'll sew it shut, and that will give us, I'll leave tails on that suture. That'll give us a little bit of handles, which you'll see later in the video why we have those. And then we'll actually be cutting through the eyelid to get back to the structures, and that kind of protects the eye. We've obviously sped this video up. I'm not that fast. And the chronic inflammation, part of inflammation is increased circulation. So these do tend to bleed quite a bit more than anything else. And just in general, there's a lot of circulation to this area. So we will warn you, there will be quite a bit of blood in this video. But I can assure you she will not feel a thing. And she will feel better with that painful eye out of there.
Now we're going to make an elliptical incision around.
So here we're going to make the incision just below the eyelids on each side, kind of an elliptical shape. We just want to go through the tissue and leave the eye alone. We want the eyeball, the globe itself, to stay in one piece as we take it out, which you'll see at the end of the video. So that gives us our windows to get back to the tissue to cut. There's a lot of muscles that surround the eye and that are attached to it, and that's how we're able to move our eyes in every direction. So we'll be cutting through the muscles and the other connective tissue in there. as you can see, she's not reacting at all. She's got butorphanol on board. She's got Vute on board, sedation, and everything's numb. So this is anytime you can not do general anesthesia and get away from those risks, it's ideal. And the standing procedures become common practice in the last decade or so. And those are the two tails, the suture I left on there. Well, I'll use those as handles a little bit later in the surgery. So now we'll mainly use scissors at this point and do some cutting, and a lot of it's blunt dissection. I'm just going in and spreading the scissors to separate everything as we begin to cut more of the other muscles and tissue back there. And our blocks appear to be working really good because she hasn't moved at all.
I don't think she's felt a thing so far. Which is good.
So again, we're just going around the eye and separating all that tissue and cutting and just kind of following the curvature of the globe in there.
So we go through that so we don't rupture the globe or anything, and I leave those tails on there so we got to handle it. When we cut the rest of the ligament and everything, we'll use that to pull it out. You can use just forceps, but give yourself handles with suture. Basically.
One thing that's always surprising is how large their eye socket is and how big the eyeball and everything is, but that's why they have such a great field of vision too.
Everything that's holding this thing in place. The optic nerve will be the last thing we cut.
You can see how far those scissors are going back there. I'm
I'm
staying away from the optic nerve.
Hard to block.
That'll be the very last thing we do because I want to make sure that the local block we put in there is working.
I put so much block in there, it's pushing everything out. But I'd rather deal with that than her feel any of this, so.
Right.
Poor thing. She's had enough pain over
So I can use my handles here, that way I can get underneath there and get back to where we need to get to actually cut.
I'm gonna open that other pack of gauze on him.
Yep.
Quite a bit of hemorrhage. That's to be expected.
Lots of hemorrhage with these surgeries, especially these ones that have been going on for a while. That, like I said, that chronic inflammation.
Sick.
You get lots of blood supply there. And that's one reason faces and,
Is your greenhouse
and cuts
sterile?
on
Yeah.
not the eyeball, but the
So I can
tissue
dump
around it,
that
that's
on
why
there.
they heal
Yeah. Or just
so
leave it
great
open.
and so
Yeah.
fast, is all that circulation to the head.
Thank you.
That'll work.
So it looks like a
about
lot more
there.
blood than it is.
To see if that optic nerve's actually blocked.
Will you grab one of the big biopsy containers? They're in the lab right beside the incubator.
Now we're just about back there, and what I'm going to do is feel and make sure there's nothing else hanging on, and if there is, we'll address that and cut it, and then get back to that nerve and
The optic nerve is like the size of my pinky, and we got to cut through it.
cut it.
On the blue. Yeah.
So we're back now to the big artery and veins back there. That's where a lot of this hemorrhage is coming from, and the muscles we've had to dissect through.
Just watch him now, because she may react as we get to that nerve. If you don't pull on it, they do better, but it's kind of hard not to.
The other thing I'm trying to do is not pull that out very hard because they can, if you pull on it, that's stretching that nerve, even though it's blocked, sometimes they'll react a little bit. But our block worked very well for this. There's been a few we've had to go in at this point and infiltrate with more block, but our block worked good the first time on her. So once you see all that hemorrhage, you know you're close to getting the eye out of there. Again, I'm using my suture tags to use as a handle. We've just about got this thing out of there.
Need some bigger scissors. I don't know. I got them. I don't. Almost done, darling.
You can see the tip of those scissors are
Really
curved
optic
too,
nerve.
which helps you get back there.
Big thick
This
rubber
thing's
band.
just about to come out of there.
Slightly smaller than my pinky. Just watch her. I'm getting ready to cut it.
I'm going for the optic nerve here. I can feel it with my hand, and I get the scissors to it.
I'll have to pack this with gauze. Try to get some of the hemorrhages stopped.
I'm just trimming the last little bit that's left hanging. And again, it looks like a lot more blood than it really is, but there's our eyeball. She didn't even know I was back there with that nerve, so that's the best you can ask for.
No more eyeball.
And I'll pack the socket with some gauze and try to stop the hemorrhage, and then we'll close up that dead space.
It just has to.
What will happen after this is the bleeding will continue,
Grandma Betty's gonna love
and
this.
our sutures will
Hey, Grandma Betty.
stop that.
I hope you made it this far. If you made it through this one, this is probably the worst gruesome standing surgery we do. You're a trooper, Grandma Betty. How old's your Grandma Betty?
72?
And she watches all these videos we do?
Yeah.
That's awesome.
Yep. She
Good
watches
grandma.
them almost the same day John posts them.
She rang that notification bell, didn't she?
I bet she did.
Be a good time to remind everybody to hit the notification bell. Is that what it is, a bell, John?
Uh-huh.
Yeah.
And
Ring the bell.
smash that subscribe button.
Smash that subscribe button. We'd also like to thank SIU for trusting us with this horse's surgery this morning. It sounds like they have literally tried everything to save this eye. U of I's got a really good ophthalmologist, and if he
So what we're doing here, I'm
can't
doing
save it, no.
close this in 2 different layers. I get the inner layer with obviously dissolvable sutures, and then we'll close up the skin. And the amount of hemorrhaging can make this a little tricky sometimes, but it'll come together good.
Does the blood that stays cooled in the socket form any type of like calcium ball or anything?
it'll form a big clot, and it'll look like she's got a fake eye behind there for a while, then it'll slowly absorb.
So you're suturing it from like the inside out?
I'm doing that fascia on the inside, yeah, then I'll do 2 skin layers.
Okay.
Sub-Q, then a skin layer.
Okay.
So some people will put prosthetic eyes in, basically to fill that dead space. You've probably seen horses with one eye that the socket sinks in. That's the only reason they do that, is to fill up that dead space. But the risk of doing that, I don't think it's worth it. So you can see the bleeding's already slowed down a little bit just from closing that. And we'll get her skin closed up here. Do 2 layers on it. There's going to be a lot of pressure in that socket when that blood's going to continue to fill that. So you got to make sure your sutures are tight. And then we'll also put a wrap on her head to apply a little pressure and protect that a little bit. So here's the last layer, just closing the skin. She handled this surgery great. She's a really great patient, easy to work on, easy to get along with, which makes our jobs way easier.
Okay.
So that's just some sterile drape we had clamped to our halter to keep from contaminating anything.
I didn't feel a thing. Let's
And that's why we use a red halter.
get some paper towels or whatever.
We got all that cleaned up,
Clean
then
all
we're going to
this
put gauze over the eye. And then use some little bit of cast padding for a little more protection, then wrap it with some elastic adhesive bandage. So she'll look like a pirate for a few days.
We'll change it tomorrow.
This part's probably harder than the surgery itself. You got to get it snug enough where it'll stay, but not too tight where she can eat or get back on her throat. Because this bandage will stay on for a few days.
We'll put the eye saver on over this too.
Okay.
And then we have a mask called an eye saver we use for various things.
Only
But
her green halter.
basically got a big hard cup on the affected eye where she can, if she accidentally bumps it or rubs it, it protects everything. So she probably had one of these as they were treating the eye at various stages too, so she'll be used to it.
If you want, we can just walk her around for a quick second so she'll sober up.
Yep. Let me grab my jacket really quick and I'll take her outside.
So here's the eye we got out of there. There's the third eyelid in that corner. There's a big T-shaped cartilage. So when she blinks, that third eyelid acts kind of like a windshield wiper and gets out of there. Sometimes we can remove just that if it's cancer or some other standing surgery like that.
Make it where it.
I'm just trimming off some extra here because we're going to put the eye in
preserve.
formalin for
They can show students.
the students to be able to see it over at SIU. It's always amazing how
Those
big
are all the muscles.
that is. Now some of that's the local anesthesia, but
She had a ulcer and uveitis that wouldn't heal, despite lots of effort. Lots of effort. Yeah, some of them they just and they get so painful. It's this is the only thing that's left. She'll be very tickled tomorrow. She had a. It looked like a pretty. It may have been leaking right there. Her eye. I'll give her some Trank so she.
so here we
stands
are
still
2 weeks
during that.
later.
She getting
She's
used to
been
everything.
home on antibiotics. And
Been doing really well.
Good.
She's loving having time outside.
I I
She
bet.
looks way brighter when she came in
She act like she feels
at the
better.
recheck
Oh,
versus the original.
Next day, she seemed like she was doing
Yeah.
much better.
That was a pretty angry eye. Not for lack of trying.
No, we definitely tried. But she has been much more her usual self.
Good.
That's typical after we take these painful eyes. We'll call to check on them the next day, and most of the time they're acting like their old selves just to get that painful thing out of there.
I'll take it off and like just scratch her, and she's like, ah.
That looks good.
So we'll take her stitches out
Really
today.
good.
And she's been non-visual in that eye, so I think she's
So
accustomed.
over time, that'll just start sinking in more and more as all
Okay.
that stuff. She's probably got a big blood clot in there still. Great.
We left these stitches in for 2 weeks.
She was a really good patient. She did. She was great.
She's a sweetie.
Travis walked back there to check on her.
I walked right up on this side.
Walked right up and scared the crap out of her.
She probably just got done being drunk too.
Yeah.
Poor thing.
Yeah. He was like, oh gosh.
Way to go.
Yep.
So.
I was gonna leave all
Probably
that
should've.
how it is, and that scab can kind of protect it
Okay.
just a little bit. I'd probably keep the cup on her
Okay.
just as a protective thing in case it dries and it gets itchy.
Gotcha. So she's not grabbing
Mm-hmm.
for.
Another week or two.
Okay. Thank you. That was my next question.
She's not got any of those
Good
spots where I've
job.
been rubbing her in.
No, I was
we've
gonna
been-
say
she's been doing really well with it. So. I know. I was playing with it.
We had that conversation yesterday. You can't help yourself.
I know you can't.
Awesome.
And John went out 1 month after the surgery to check on old Amazon. Surgery site still looks good. They said she's
little more that
acting
scab.
great. So
Fall off, it's not quite.
back to her old self.
Doesn't seem to be bothering. She just walks around like normal.